country surpassed 3 million positive COVID-19 cases. To put this into perspective, it took 99 days for our country to have 1 million cases, 43 days to reach the 2 million person threshold. And just in 28 days, less than a month, we have as many cases that we've added as we did in the first 99 days. COVID-19 hasn't gone away. In fact, it's gotten worse. Tonight I want to talk to you about the things we are doing, and first start with my thanks, because I know how hard people out there are working hard to wear their masks, wash their hands, keep their distance, and yes, stay at home whenever possible. That most people are engaging in these things that do work and are the main weapons. I was hearing from a public health professional today who would have thought that just doing those three things was the majority of the work that we have to do. And yet those three simple things are the powerful weapons that can defeat a virus, slow its spread, save lives, keep our economy strong. These are the things in our hands, and I want you to feel the power that you have to save a life. And I'm grateful to everyone who's taking this threat seriously. What you do matters. The actions you take have consequences, and we are making progress. And while it is fragile, it is still progress. We came together and slowed the spread of the virus in March and April and May, and we're doing that again right now. But to be clear, on the other hand, and we've all seen it, we know it, maybe some of us have participated in it, there are still too many social gatherings, maybe too many pool parties this weekend, too many play dates, too many family barbecues, not just with your household, too many group activities. This is what COVID-19 thrives off of, the momentary pleasures of one day that stay with all of us for months in the days ahead. Today, more than 50% of the people who are testing positive in Los Angeles County are between 18 and 40 years of age. Remember just a few weeks back it was 30%? Then when I talked to you last week it was 40%. Today 50% of those cases are with our younger Angelenos. So to young Angelenos and Angelenos under 40, please do your part for all of us. To parents, I need your help. I need you to keep your children away from parties and gatherings with their friends. I know it's the summertime, and our muscle memory goes back to being together, to want to hang out with one another, to thinking, well, I don't know anybody who's been sick or in the hospital, so I'm probably okay, and they're probably okay. Maybe I'll get together in a group instead of hopping on a video chat, or young people that we see not covering their faces and physically distancing. And most young people are doing the right thing, I want to be clear, but it's clear that a lot of them are not still. And so they're winding up in the hospital, or if they're not winding up in the hospital, they're passing on to their parents and their grandparents this deadly disease. This isn't complicated. Do not get together with someone who's not in your household. These weeks are absolutely critical. Critical to whether schools open, whether our economy and our economic recovery path continues. These weeks are critical for saving lives. I was reading an article today about how suddenly when we hit numbers like 100,000 deaths, the difference between 100,000 and 110,000, we don't feel anymore. It's just human nature. But think about that, 10,000 deaths, and begin to picture each one of those people and the relationships with their families, the loss in their communities. We have to get back to feeling what this is about and the power we have to give a life, to save a life, to keep a life. We cannot let our guard down. I'm in frequent communication with the County Department of Public Health and with the governor and our state government, and all options remain on the table. We will do whatever is necessary to limit the spread of COVID-19, because improving our public health is the vehicle to reopen our schools and to keep our economy moving forward. As one of our leading infectious disease experts, Dr. Kim Farley at UCLA has said, and I shared this with you last week, but I want to repeat it, the only way to open the economy is to do it gradually, and then dial things back if the disease spreads and risks overwhelming our hospitals. That's exactly what happened last week. With a surge in cases, we dialed things back. And the governor closed bars and shut down indoor dining. We know so much more about this disease today than we did in March when it first hit us. And that means we can make targeted interventions to stop the spread of this novel coronavirus. But making sure we don't have to go farther and close more businesses requires an individual commitment of each and every one of us, from businesses and the people of LA. When we opened bars and indoor dining and restaurants last month, the County Public Health Department found 83% of the 3,700 bars and restaurants they visited were violating some part of our public health protocols. But people are hearing that there is a consequence for noncompliance. And I'm glad to report that the county shared with us today that their inspection saw a 90 to 98% compliance rate among those same entities. That's good news. People are hearing us, they're doing the right thing, and helping save lives. Exercising caution is especially important in our workplace settings as well. Many of us are back at work for the first time in a long time, and I want to reiterate that if you can work at home, work at home. But businesses that are allowed to reopen don't have to reopen, but if you do choose to open your doors, there are rules to follow. You can't pick and choose between them. You have to abide by all of them. So businesses, I'm asking for your help. Follow the city's protocol. Protect your employees, protect your customers, protect our economy, and protect lives. And that guidance is available for you, coronavirus.lacity.org/business. It's been written with and for business over many weeks and months. It's good guidance and it's required action. There's no excuse to break the rules, period. Offices should only open if teleworking is not an option. Now is not the time to return to crowded indoor workplaces. In fact, the 3 C's are things we should all avoid: crowds, confined environments, and close contact. We all know that. We have some people who don't stand 6 feet away. I had a great person who shared with me that it's kind of like, for the basketball fans out there, the Lakers triangle offense. If you're too close, make a triangle between you and other folks. Make those 6 feet on each side and make sure you're abiding by it. Our city government offices ourselves remain closed except in cases where teleworking is not possible. So we're trying to lead with our workforce by example as well. This virus doesn't care if you're gathered at a barbecue or a workstation. It will spread if you're near others, period. You should assume that all around you are infectious. Those numbers from last week of 1 in 140 people are sobering. Sobering for those of us that have to still work on frontline jobs, sobering for those of us who go into the public spaces or places to get food, to the grocery store and others. Use your judgment, assume people are infectious, keep those masks on, sanitize the surfaces, and keep your distance. We need to protect the progress we've made, and we can do it. You can do it. But today's COVID infection threat level remains at orange. That's bad. That means that the risk is high, and you should assume that everyone around you is infectious. Continue to stay home as often as you can and only participate in essential activities. If things get worse, that dial could move to red in this coming week or two. That would place us at the highest risk of infection, and we would likely return to a mandated safer at-home order. But if things get better, we'll see that dial back down to yellow, indicating we're successfully flattening the curve again. You can always track the status of where we're at coronavirus.lacity.org/threat level. And it's important to always be guided by data. I've been so proud of this city and this state, listening to medical and public health professionals and using the data to inform the decisions we make as individuals and collectively. So today, let me share that with you. Today, the county recorded just under 2,500 new infections, 2,496, bringing our total to 123,004 verified positive COVID-19 cases. 801 of those were in the city of Los Angeles, bringing the city of LA total to 52,088. Hospitalizations have been steadily, if slowly, but steadily climbing, and have now reached 2,004. This is the highest level of hospitalizations we have had since this began. That said, our ventilator supply remains very robust, and the treatment lessons and the use of the drug remdesivir, the utilization rate remains lower in our ventilators because of those 2 factors than the initial days of the crisis. That's good news. Our ICU bed inventory remains fragile, but sufficient, and we are confident about its expandability today. And other decently good news is our infection rate, which was up at 1.26 last week, is now estimated to be at 1.01. It's still more than one person that each person who is positive is infecting, but just over one. And if we continue the work of this past week, we could see that go down even further, perhaps the strongest and most important leading indicator of where we're at. As I said a week ago, the next 2 weeks, meaning this past week, this week, things won't get better. And in fact, we'll probably see deaths, which are a lagging indicator, in the third and fourth week go up. But these are hopeful signs. They will only remain hopeful if you continue to have that sense of discipline, maybe even that sense of panic that some people had, that this could get out of control again, and that we make the right decisions and do the right thing. Every day, every week matters. Our choices, our care, our concern matters and makes a difference. Another indicator that we track closely is the positivity rate of tests. What percentage of overall tests come back positive versus negative? This number currently stands at 9.3% positive, which means it's increased significantly in the past few weeks. It's well above where we were in late May at 8%. The 7-day average of new tests is 11% positive, which means more people are testing positive now. Yesterday at city and county testing sites, the either drive-up or the walk-up ones, we tested 20,000 people, a new record. It's the most we've ever conducted in a single day, and today and tomorrow morning, by tomorrow morning, the city and the county sites will have together tested over 1 million people. 1 million tests, free of charge, in our communities, one of the strongest and most robust testing programs, not just in this country, but of any city in the world. Today, I went to Kedron Community Health Clinic in South Los Angeles with Councilmember Curran Price and activist, actor, and Angelino, Anthony Anderson, who we all love from Blackish, as well as Capri Maddox, who is our equity officer and the head of our new Civil and Human Rights Department here, to underscore the message, especially in communities of color, where they speak Spanish, the African American community and others, that testing is important. The next 2 days are booked up as we make up for the holiday weekend, but we are adding more tests on this Saturday and into next week. And we're seeing our turnaround times skyrocket across the country to 7 or 8 days, but here it's still 1 to 2 days. These numbers are among the strongest in the nation, but let me be clear, it is not enough. We need more help with testing. As I've shared with you in each of these gatherings, the city of Los Angeles doesn't even have a health department. We knew nothing about testing when we started this, but we decided to step up without prejudice about where you live to anybody in the county and offer at no charge testing conveniently where people are at. We expanded that from people with symptoms and frontline workers to those who had been exposed or believed they were exposed, and then to asymptomatic folks who need to go back to work or other things like that. We hear every single day that there are not enough tests, and while we had just 2 weeks ago more test capacity than people were using, we know this last week pinched that capacity, and we are building that up, expanding by almost 100% the number of tests in the city sites across the city of Los Angeles. We see choke points nationally in the supply chain, everything from reagents to some of the swabs, and the surge in states like Texas, Georgia, and Florida have caused labs to be past their capacity across the country. Though I want to be clear, the ones that we have here and the curative tests that we have are able to respond quickly, we're able to ramp them up, and we're going to continue doing that. But without a major boost in testing, which we will be fighting for in the next coronavirus relief bill, these numbers nationally are not sustainable. There's no way we can functionally reopen the economy or safely reopen our schools. And to be clear, schools will only open when they are safe, and this is a key part of it. Congress and the President need to set aside any of their differences and to pass another relief bill now. Expanded testing and direct assistance for cities like ours that are stepping up and paying out of our pocket for these tests. Funding more local community health workers, real small business assistance, expanded benefits including unemployment, another cash payment for folks who are struggling, and aid for state and local government. It is a clear, crystal clear list that isn't about red or blue, Democrat or Republican. It is about red, white, and blue, and these United States of America. If we are to be one nation, we need to step up and continue to prove it. So testing remains a critical tool. You may not realize it, but you can ask your own doctor for a test if you have any symptoms at all. You can also get tested at CVS and at community health centers. There's in fact more than 100 places that you can get a test, and they're all listed at coronavirus.lacity.org/testing, or just call us at 311 if you don't have internet access. It's a no-brainer. If you think you've been exposed to COVID-19, go get tested. But we've had a lot of questions about whether everyone should get tested and get tested regularly. Today, the County Department of Public Health gave some good guidance on this, on who should get tested. They said that tests should be prioritized for people who have symptoms, those who think they've been exposed, or who are essential workers or work in a high-risk environment. We're receiving reports that people are getting tested so that they can just go out and hang out with folks. That's not what these tests are for. A COVID test isn't an excuse to break the rules and engage in social gatherings outside your household. It's not an excuse to not wear a mask or to not maintain social distancing. A test is not a passport to party. Don't go out with your friends. More people are getting sick. Supply chains are getting constrained. So we're asking you to be responsible, even as we offer these tests to all folks with and without symptoms, about when you get a test and why. It will help save lives. We also know that every single day, this is not just a healthcare crisis, it's an economic crisis. People are suffering, and I want to speak to some help that is on the way. We know that folks can't pay their bills. They're worried about whether they'll lose their homes, whether they'll get kicked out of their apartments, whether they can put food on the table or meet some of their basic needs. Too many people are struggling these days, and that's why early in this crisis, we took swift action, putting a moratorium on evictions. We froze rent for our city's rent-stabilized units. And that's why I worked with my city council colleagues to prohibit landlords, too, from taking advantage of tenants and to guarantee renters a private right of action if emergency protections are violated. And as I've always said, for those who can pay their rent, they should pay their rent, because landlords have expenses and many small landlords are also having financial difficulty now. And the last thing we want to see is our mom and pop landlords in this town lose their apartments, get bought by the banks, or go to the banks and get bought up by corporate housers. We know that many tenants still, though, cannot meet their rent obligations. That's why, working with our city council and Council President Martinez, we've created the Emergency Renters Relief Fund, which will be the largest renter relief fund in this nation. It provides $100 million to help renters stay in their homes and get welcome relief from the financial stress that they are experiencing. This program provides $2,000 badly needed dollars to help cover rent for our hardest hit households. If you earn 80% of your area median income, the average income, or less. And it gives financial relief and additional protection to renters, as well as support to landlords. It's really a win-win-win. Eligible tenants must live in the city of LA, be economically impacted by COVID-19, the loss of job or hours specifically from that, and have that household income at below 80%, which for a family of 4 is about $83,500. All renters can apply, regardless of whether they're immigrants or not, wherever they live. It is universal. Now, applications for this program will be accepted starting this coming Monday, and we'll be talking more about this. You'll be hearing from City Council members, City Council President Martinez, myself about this each day. But it opens up on Monday, July 13th at 8 a.m. and remains open until midnight on Friday, July 17th. It is not a first-come, first-served program, so don't worry about needing to call or log in on that first day. That will not impact the order that you apply in this coming week, will not impact whether or not you are selected. It's run through our Housing and Community Investment Department, and I want to thank the people who have been working so hard for these past weeks to stand this up and to make sure it functions on day one. And eligible applicants will be randomly selected if we have more applicants than money after the closure of the application period. Today, you can learn more about it. You can't apply for it today, but if you want to familiarize yourself with it, please go to our Housing Department's website. That's at HCIDLA. So HCIDLA .lacity.org, or call us at 844-944-1868. And some of the frequently asked questions are already up there for your convenience. We're doing everything we can to help those in need. to protect our most vulnerable, stop the spread, and to save lives. And one way we're doing that is through Project Room Key, which is helping our unhoused Angelenos that are living on the streets of LA or in vulnerable environments to have hotel and motel rooms with food, a safe place to be, and to make sure that they don't become COVID-19 positive. I volunteered at one of the hotels that is housing our fellow Angelenos, and let me say it was a great experience. Wonderful to talk to the folks that are there. Many of them are working. Yes, they're homeless and working while at Project Room Key. The folks that are providing them with meals, I thank you. The disaster service workers who are city employees that usually work in other jobs who are there every day, I thank you. They're making a difference, and I have some good news that we've just secured yet another hotel for this program, just outside of downtown Los Angeles with 294 additional rooms, bringing the total number of hotel and motel rooms in LA to nearly 3,900. I'm so grateful to the governor and everybody who stepped forward to help this program get off the ground and to keep going. Through all of this, the city is committed to helping every Angeleno get through this crisis. We see that with our city family, from Rec and Park staff who are helping our homeless neighbors at emergency shelters, to other disaster service workers who have stepped up, joining the county, over 300 of them now, as contact tracers from the city under the county's supervision. But I want to speak about a very special angel in the City of Angels, somebody who committed her life to the people of LA. LAPD Senior Detention Officer Erica McAdoo, who died from complications due to COVID-19. We lowered our city's flags in her honor. The governor joined us as well. I talked to her mother, Donna, today, and she told me about Erica's story, how she was born in Tulsa, Oklahoma, moved out here with her mom and her sister when she was 9 years old, graduated from Bellflower High School, and went to Cerritos College, studied the culinary arts, worked as a chef, and then decided she wanted to dedicate herself by becoming a worker for the city of Los Angeles and to serve the 4 million souls that call LA home. Angelenos were so fortunate that she made that decision. She chose this path, determined to give back to a city that had given her everything. Her mom tonight, when I was talking to her, spoke about how she was wise beyond her years, how sometimes as her daughter, she'd take care of her mom. We all know that. We have kids who sometimes seem wise beyond their years, and Erica was one of those people who just spoke with a certain authority, whose coworkers loved her, and she had a real impact on the life of our city. The active services that make our city stronger, that city government that I said would never close, even in the midst of a crisis like this. But unfortunately, she succumbed after 3 months of fighting to COVID-19. I want to say to Erica's sister and mom, an entire family, how our hearts are broken with you, how each one of us mourns with you and the families of everybody who has lost someone in this cruel, cruel crisis. Her mom, Donna, said that she felt God towards the end, and she said that God has something big planned for her, and I know that he does, and that she and each one of the angels that has fallen in this city is watching over us and asking us to do everything we can to keep their numbers as small as possible in heaven, to make sure that we have the neighborhoods and the families and the strength on our streets that we should, that we have the power to do something about. The City of Los Angeles mourns with Erica's family. We are here for you, and your service will never be forgotten. Nobody wants to read about more cases. Nobody wants to learn of more deaths like Erica's or the thousands of others lost in our region. Nobody wants to take more steps backwards in our reopening journey, see more careers or livelihoods or small businesses lost. We all want to have COVID under control. We all want to see a better day come. And that will be a product of what we do today and the choices that we make tomorrow. I want you, as I close, to picture somebody who you love, who's vulnerable. Maybe it's because of their age. Maybe it's because of their medical condition. Maybe it's somebody you know who's unhoused. I want you to hold them in your head and in your heart. And I want you to make every decision moving forward based on protecting them, on protecting them, on stepping up with the power that you have to keep them safe and to keep us all strong. Let's hold our loved ones who are the most vulnerable on the front lines with us every day and keep wearing our face coverings, stop gathering, and stay safe and stay healthy and stay at home. Strength and love and justice to all of you, Los Angeles. Thank you. With that, I'll answer some questions, and I'll speak in Spanish afterwards. First question, please.
Thank you. And our first question comes from Claudia Pashuta from KNX News Radio. Please go ahead.
Hi, Claudia. Good evening.
Hi. I have two questions. One of your staffers told me yesterday that the city's 7 testing sites could test up to 15,500 people a day. You said capacity at the LA sites is going up by 100%. So does that mean they'll be able to test up to 31,000 people? And if so, by when? And then my second question is on the City Hall corruption scandal. I'm just wondering, how could so much allegedly blatant and widespread misconduct go on for years, and whether any major changes are planned to prevent something like this in the future? Thank you.
Thank you. No, I wasn't talking about doubling again. I said that we had doubled. So, excuse me, to get to 15,500, that was double what we were doing just a couple weeks ago, and we were able to do that within a matter of days. So no, we aren't planning and don't have the capacity, just even with the personnel, to get to 31,000. It was a doubling to 15,500. And the county sites are, though. The county sites do about a quarter of the overall tests, and we do about 3/4 of them in the LA City ones. I know they're looking at opening in the next 2 weeks a number of sites and bumping up the capacity in each one of those county sites, which has usually a slightly lower or quite lower throughput than some of the big city ones, like obviously Dodger Stadium, nothing comes close, but even Crenshaw Christian and others. So I know that the county will be adding thousands more tests in the coming weeks as well. In terms of the scandal at City Hall, I mean, what I've learned over time, 19 years being here, is bad people can do bad things and they will find ways to get around any law. That said, I absolutely not only wholeheartedly support, but have suggested the following as a way to tighten up. I supported last year a change that was made since this all began, even as we see people now pleading guilty. The first time that we found out about this, City Council, and with my support, outlawed donations from folks that are, for instance, developers who have things before people. I'd like to see a system like we have at LA Metro, our county metro board. As a board member, I can't vote on anything if a family member, an associate, a subcontractor of any business has ever given to you. You're recused. And maybe that would dry up the idea of people thinking that they can somehow buy influence, because whatever influence they buy, they've now just lost the capacity for that person to even vote on their project. So I hope by ordinance, the council can pass that in the coming months, and that maybe we put that into the city charter itself, as it is in the rules of LA Metro. I think that would go a long way. Thanks, Claudia. Next question, please.
Thank you. And that comes from Lee Ross from Fox News. Please go ahead.
Hey, Lee.
Good evening, Mr. Mayor. What confidence should Angelenos have in their public safety when the state and county are, because of coronavirus, releasing thousands of inmates? The city, under your direction, is cutting the LAPD budget, and now reading in the LA Times a so-called blue flu amongst the rank and file over a holiday weekend?
I think people should be very confident in the public safety. Crime is down, although we do see, and nationally, although here it's a lesser level, that we've seen some of the homicides go up a little bit. But our major crime is down, our property crime is down, our violent crime is down. There's no question this is a very difficult period. But our coverage also is strong. Even when folks haven't been able to show up, and I don't think that nobody so far has seen evidence of a quote-unquote blue flu. The police union has spoken out against that. It's something not permitted under city contract, and we're able to cover, thankfully, with enough of a workforce, folks who aren't able to show up, whether it was with LA Metro or some of the examples that folks pointed to over the 4th of July weekend. And to be clear, too, even as we make reductions, we still are able to keep the patrol levels that we have expanded quite a bit in the last few years. We've added 1 million patrol hours just in the last 2 years alone, and that's why crime is down at a historic level. In terms of the jail and prison question, which is not for us, that's a county and state thing, I think it is very important as we have folks that are released that be done in as logical a way as possible. That those who are violent or of great threat are not released, and those who are nonviolent should be. From a public health perspective, that is critically important. But I know that there is close work that our police department, that the corrections officials do at the county and state level in assessing those folks, and that there is not just a willy-nilly releasing everybody. Again, I'm not in control of those releases that happen at the county level, but I do trust that those are being done in a sound way, and statistics don't lie.
Thank you, and that comes from Joel Pollack from Breitbart News. Please go ahead.
Good evening. Go ahead, can you hear me?
Mr. Pollack, you're
Hello,
live.
Mr. Mayor, can you hear me?
Yeah, we can hear you. Go ahead.
All right, thank you. Two questions. First of all, with regard to school closings, there's some data from the U.S. Census Bureau to suggest that women and minorities are having a disproportionately hard time finding work because of the pressure of staying home to care for children who are not going to school. And I was wondering if that's being taken into account in school openings. And then, secondly, I was wondering if you could comment on the debate about cancel culture, which is happening both on the left and the right in America today.
Sure. You know, I believe that I believe in human beings and their capacity to always be better and to find common ground. So it's something foreign to me. Certainly, you see that. I do think people should be held accountable for what they say and what they do. But what we need is opportunities to strengthen dialogue and to change people's hearts, to change their words, to change their actions, not necessarily to see if they can be erased from our existence. We are all going to have to live together, find ways to live together. It was a lesson of the last, unrest that we had here in Los Angeles of finding ways to get along. And things like days of dialogue that came out of that, I think, are critical for moments like this. In fact, we're looking at places where young Angelenos of color and police officers can find safe places to have those dialogues and to understand each other, so that a police officer can understand what it feels like to be a 15-year-old black young man in Los Angeles and his interactions with the police, and vice versa. That young man can hear what it means to be a police officer and not know if you're going to come home to your family each night. Those spaces and places are really important. So that's what I'd say about the second question. In terms of the first one, I'm really glad you raised this, because I've said in these briefings before that you're exactly right. This disproportionately hits women in particular. Without schools, or in the summer, that's why we're doing the summer camps, and childcare has never been closed down. That has been seen as an essential business, an essential need, obviously, essential service. You will see a disproportionate impact on women, and yes, to many of the frontline workers who are people of color who aren't able to return. So we need schools to be open, not just for our children's development and education and mental well-being, but also for our economy to function, which is why July is so important. Schools can't open if they're not safe. They can't just be mandated. I know the president said they will open. I wish we could just say they will, but it really depends on our behavior. If we see numbers level off, then I think we will be in a position to have some level of schooling in the fall. But if they don't, I bet people will not be able to go back to school because it will be unsafe. So it's really up to us. This July will be absolutely critical. So I hope that folks are getting loud and clear the message of tonight. There's some hopeful things in this past week. There's also some very fragile and very dangerous things still happening. So we need to keep that momentum, keep going even further than maybe what we did in this past week since we saw those numbers tick up. And if we do that, we should be in a position to help those mothers and fathers and others who depend on school, and most importantly, to have our young people have at least some modicum of face-to-face instruction and social contact with their peers. Thanks. Next question, please.
Thank you, and that comes from Steve Gregory from KFI News. Please go ahead.
Steve, how you been? I miss you, man.
I'm well, sir. I'm happy 4th, belated.
Thank you.
Hey,
You too.
listen, to coattail a little bit on my colleague's question about the so-called blue flu, the officers I've been speaking with are painting a pretty bleak picture about morale within the department, and they're telling me, I was sent a copy of this letter that went out last week encouraging people to call off between July 3rd and July 5th, and I've read it, and they are very upset, and they feel like they've lost confidence in the leadership of the city. I'm wondering if you have a message to those rank and file members of the LAPD, and anything you can tell them to encourage them looking forward. Also, do you have any comments on a newly created division, the Community Engagement Division? Thank you.
So a couple things. One, and I always get heat from folks who are looking to reform our police department, a vision that I share whenever I say anything positive about our police officers, but I will not stop doing that. I know that our police officers have in their heart a desire to serve and have stepped forward where many people don't, to put their lives on the line. And I've seen the life-saving work that they do every single day. I've also seen changes that we need to continue to evolve in our police departments, but I do want to address morale because I know among some officers it does feel very low. The reflection of that care is in everything from the contract that is before you right now to the way that Los Angeles Police Department is sharing a cut that other departments have already experienced too. Not just being singled out, but as I've always said, there's nobody immune from that, and they should look at that and take that as something which is all of us chipping in. That when we invest in communities to prevent crime, to intervene before crime happens, that lessens the burden on their shoulders as well. I think our officers have a strong sense of duty. They're not ones who will back away from a challenge or somehow just because somebody puts an anonymous letter out there saying don't show up. They believe in this community. They believe in this city. They believe in helping their fellow human being, and they will show up. So we might see bits and pieces and pinches at moments, but I do want to put out there that this is a single city family. And while I expect accountability from every city employee, whether they wear a badge or not, we just talked about a corruption scandal here at City Hall. People do have to pay for the price of and answer to consequences for their actions. But that doesn't mean that everybody who works for the city or everybody who is a police officer somehow has broken the law. We need to somehow get back to a place where we co-create the next chapter of what public safety means. That will include a good police department filled with good police officers that reflect our community and have the values, the culture, and the courage that I've seen this department exhibit and that I know we can even go further. It will also include lessening the burden on police officers and thinking about why do we call the police so often for so many things when it comes to mental health, when it comes to our homelessness epidemic, when it comes to things that we could have non-police interventions that could help us, as we've successfully done with gang reduction and youth development, find those folks, especially in communities of color, who are well-trained, well-positioned, and have the lived experience to make sure that public safety is not just something we throw on policing. Those two things aren't mutually exclusive. So to our officers, I say thank you. I say step forward and be part of this together. There are a million ways, and I know a lot of people have reached out to police officers to thank them during these difficult times, while at the same time we have to do the work of holding everybody accountable. And those two things will march forward together. More announcements about that in the coming days. So I'm not going to get quite yet to our community safety partnership, some of the other things where we see really successful models out of this Los Angeles Police Department, the way that the officers themselves, not just activists or the public, have helped reduce the number of deaths. These are things that everybody can own. And I hope that every officer will, every member of the community will, and every leader here in City Hall will. I'm confident these days we'll turn those pages, write a bold chapter, and we will need police officers to be a strong, brave part of that. Next question, please.
Thank you. And now to the line of Tom Tapp from Deadline.com. Please go ahead.
Hey, how you doing?
Good. Hi, Mr. Mayor. Thank you for taking my question, and thank you so much for what you've been saying about testing.
Yeah.
It seems like that's becoming an increasing concern for a lot of people, and it's great that we did, 20,000 tests today, but the city has 4 million people in it, and when I look at those two numbers next to each other, it scares me a bit. So I'm wondering, it's great that you called on Congress and the president. I'm wondering if you could amplify that and talk about some of the urgency around that as we go into 2 weeks that are crucial here.
Yeah. And I've read your piece in Deadline, and I know there's a lot of kind of confusion and misinformation about testing out there. So I'm really glad you asked these questions, because I guess you asked me, does it scare me, or it scares you to see those numbers? Don't be that scared by those numbers, first of all, and I'll tell you why. But at the same time, we need much more. We saw just as recently as about a week or a week and a half ago that we had built enough capacity that every single day thousands of appointments and tests were not going filled. We saw at that time about a 30% drop-off rate of people who had signed up for tests but wouldn't show up. Then it was last week where that tightened up. About only 10% of people weren't showing up. Suddenly we were seeing a surge in some of the numbers. And that's when we added a 50% more, or 100% more capacity, of the city sites just in a matter of 2 or 3 days, which is, trust me, in the testing business, no easy feat. There's a few things you need for successful testing. You need sites, you then need personnel, and again, these are usually trained medical professionals or volunteers who have to go through a training. Right now in the city sites, it's firefighters who, and this is not their primary responsibility, together with CORE, the nonprofit that's done an exceptional job training everyday Angelenos who show up and put themselves literally out there as frontline workers in the midst of a pandemic to help. Ones who I joined at the Crenshaw Christian Center. I also volunteered as one this week as well. So you need the people, and then of course you need the tests. Fourth, you need the turnaround time in the laboratories. We've integrated those things together. So we have one of the most successful models in the country, but being the most successful is not being good enough. So we're constantly trying to improve that, constantly trying to add to that. We're also saying with the messaging that folks who just think this is kind of like a prophylactic, you get your testing done and then you can do whatever you want or make up for that pool party you shouldn't have gone to or the time you didn't wear your mask. Stop wasting these tests, stop doing those things, and make sure that that can help us expand that capacity back. Then we also hit the holiday weekend. I think there were a lot of conspiracy theories about why things were closed. We only close things down when we don't have enough volunteers to show up. And as human beings, whether that was that first 2 hours of some of the unrest that we saw here when there was looting going on, which we quickly got back online, or whether it was over a holiday weekend in which people said, we need to take a break, those were the reasons why we didn't have 3 days of testing. I'm confident that in a week, within the next week, we'll get back to meeting whatever the capacity is because we have the ability to scale that up, together with the county doing more. And I would remind people, because this message isn't really getting through strongly enough, you can go to your doctors, your clinics. Testing is available there, especially for people symptomatic. It should be available for people who are without symptoms too, but we see too many providers kind of cautious about that because they're not sure whether they'll get reimbursed. They will, they should. I want to put that message out very strongly to those clinics, hospitals, and other providers and doctors. But if you have symptoms, go to the doctor you always go to. Get a test there through Kaiser, through your local hospital, through Cedars, wherever you go. And that also will relieve that impact. Third, places like CVS now have them as well. If you're in key dangerous populations that are vulnerable, to COVID-19, whether it's folks in public housing who might not be able to get to one of these testing sites, senior nursing facilities, the skilled nursing facilities, people experiencing homelessness, we're going to you. We're testing in 6 to 8 weeks all of our public housing developments. That's about 25,000 different units just across Los Angeles. We've completed all of our skilled nursing facilities, and we're going to go back to them again. So there's a lot of testing pieces, which is, I understand how it could get confusing. Last part, and I know it's a long answer, but important stuff, is I will amplify to our federal government. We're going to see, I think LA will be a little better insulated, but we're going to see across this nation a testing emergency. If we can't make sure that there is the supply of the reagents, of the swabs, of the lab capacity, and of the personnel, and one of the things I've called on is to have local health workers who can do contact tracing, but in some cases who might also be able to work in these laboratories. Local folks who are out of work, who might qualify for this, that we can ramp up. We need Congress to pass something now, and we need national leadership. So this isn't, again, a dog-eat-dog, single pie that everybody's competing over, so that if Florida does a good job, California's screwed, or if Texas is doing okay, Washington State suddenly doesn't have its supply. We can't afford that. But here in the city of Los Angeles, we have a local supplier. We've worked with them with an integrated vertical capacity. They do the lab, they provide the tests, and they're helping us get them to and from the testing site. So it is among the best in the country, if not the strongest, but we still need more. Does that answer everything comprehensively?
I think so. Thanks so much.
Okay, you bet. Thank you. Next question, please.
Thank you. And our next question comes from Lori Perez from CBS 2, KCAL 9. Please go ahead.
Hi, Lori. How are you?
Hi, Mr. Mayor. How are you? I'm sorry,
Good.
just trying to be very clear here. So I know you had a lot of suggestions about different places that people can get tests from their personal doctors, from CVS, et cetera, and that the priority is going to be for people who have symptoms or who are essential workers. But are you saying that people who do not fit into those categories will not be able to get a test
No.
through the city?
No, and I want to
Will
be...
the city be following the county's guidelines?
No, so we do follow the county's guidelines. They are saying priority should be given to those, and we do give priority. We've always had an algorithm that puts first folks with symptoms, frontline workers, before people who don't have symptoms. So we will continue to do that prioritization. But no, loud and clear, we are not saying if you don't have symptoms, you can't get a city test. We are still giving tests to people without symptoms, but I did want to make sure that people aren't abusing that they aren't, for instance, just going out and taking whatever behavior they want because they got a test 3 days ago, or using it as an excuse to not wear your mask and then just get tested once a week or anything like that. But no, loud and clear, still without symptoms, you can sign up. The prioritization will put you at the bottom, so you might have to wait a little bit longer, but I'm hoping we'll get back by next week to basically next day appointments reopening again. Right now, the delay is 2 days. We're going to have Saturday ones that are available starting tomorrow morning. Okay. Thank you. Next question.
Thank you. And our final question tonight will be in Spanish, and it comes from the line of Victor Cordero from Estrella. Please go ahead.
Hi, Victor. Buenas tardes.
Alcalde, ¿qué tal? Muy buenas tardes. I'm going to go ahead and ask my questions in English, and then I'll respond to. I'll do them in Spanish really quick, and then hopefully you can respond to me in
Great.
Spanish. Every time our Governor Gavin Newsom comes up with an idea, with an order in regards of the pandemic, you echo his words and his actions. And I do understand that you both are trying to keep everybody safe. However, there are some people that aren't very happy with the words of the governor and quite frankly with his actions. In fact, I was driving in Burbank and Long Beach today, and I saw a couple of posts from people saying with signs, you can sign here to recall Governor Newsom. So what's your reaction to that? Number two, really quick, what do you think about the words of our President Donald Trump and the White House trying to send our students to school this fall? And last but not least, if you can elaborate in Spanish about the controversy with LAPD officers, about the story that came out this morning in LA Times. Alcalde, ¿nos puede decir cada vez que el gobernador Gavin Newsom da una orden o habla acerca de la pandemia, usted secunda sus acciones y sus palabras? Entiendo que ambos quieren cuidar la salud de todos en la comunidad. Sin embargo, hay gente que no está muy contenta con las acciones y las palabras del gobernador. Si nos puede decir qué piensa al respecto. Número dos, la reacción que tiene usted en cuanto al presidente Donald Trump y la Casa Blanca, que quieren mandar a los estudiantes a las escuelas este otoño. Y por último, si nos elabora en español acerca de la controversia que hay con los oficiales de la Policía de Los Ángeles sobre la historia que salió esta mañana en el LA Times. Gracias.
Thank you. I'll answer in English and then in Spanish real quick. So the first one, just briefly in English, absolutely. I think the governor has, when he has made the decisions for what closure should be, I have been supportive, and I usually talk to him and consult him. I know we'll never have 100% of people satisfied. You never have 100% of people satisfied about anything. But these are made based on data. They're made in the best interest. I don't think we've disagreed on anything, except I thought that some of the reopenings maybe were a little fast in the state capacity, and I encouraged him, and he did take this advice, to act regionally, because you can say LA County can't do something, but if Orange County can or San Bernardino can, we don't have walls between our counties. But I want to praise his leadership, thank him for his leadership, and I'll say that in Spanish. Por la primera pregunta, sí, yo soy con el gobernador Newsom, y no tendremos 100% de la población con estas decisiones, y estas decisiones son muy difíciles, pero es importante proteger a la gente. En mi opinión, una de estas veces fue una diferencia, pero fue muy pequeña. Por ejemplo, yo quiero ver decisiones por una región, no solamente por un condado. Porque si hay una provisión en el condado de Los Ángeles, pero no existe en el condado de Orange o San Bernardino, es difícil prevenir un brote de COVID-19. Pero él ha sido un líder excelente. Estas decisiones son muy difíciles, pero estamos juntos y somos juntos con esto. Second, with the question of schools and Trump, look, I wish you could just will these things, but you can't. You need to provide leadership to make them happen. You can't dictate that a school will open. You have to provide the help on testing, the guidelines to make that possible. And teachers, students, parents are not going to return to schools if they don't feel safe. You can't just mandate that that happen. So I hope that the president will work together with all of us that are struggling to make sure that July is a defining month, that we have the resources, that we have the tests, that we have the PPE, that we have the preparation and the standards that would allow schools to reopen. Las palabras de presidente Trump de las escuelas son aspiraciones, pero necesitamos acciones, necesitamos ayuda concreta, necesitamos la protección, coberturas faciales, más pruebas para nuestras escuelas y las familias de los estudiantes en nuestras escuelas. Necesitamos también acción del presidente Trump, pero de todos nosotros, para proteger nuestras familias y defender la comunidad contra el COVID-19. Sin esto, las escuelas será muy difícil reabrir nuestras escuelas. Con estas acciones juntos, nosotros podemos ver un día donde nuestros hijos y hijas están en las escuelas otra vez. I think that we haven't seen widespread evidence. I know these things become viral and everybody thinks that it's widespread. I said in English, but I'll say it in Spanish too. Yo tengo la confianza en nuestros oficiales, su dedicación a la misión de protección. Para ser un oficial del Departamento de Policía, pero estas personas son muy fuertes, son héroes en muchos casos, pero necesitamos cambiar nuestra visión de seguridad pública y juntos con estos oficiales pueden ser los escritores con activistas, con líderes, con miembros de la comunidad del próximo capítulo de la seguridad pública en Los Ángeles. Pero estas personas, estos oficiales, han protegido las comunidades de Los Ángeles, tienen una dedicación a esta misión, a proteger personas que no son miembros de su familia, de su comunidad. Pero también es finalmente tiempo a mejorar la cultura, la actitud, el entrenamiento y los recursos que oficiales tienen y mover ciertas de estas responsabilidades a otros líderes, otras personas, personas que pueden traer, por ejemplo, en nuestros programas de desarrollo de juventud y antibandía, tuvimos, porque la responsabilidad de seguridad pública no solamente es la responsabilidad, mucha evidencia de yo cuido mucho por los oficiales en este departamento, pero estamos en parte de este momento difícil y continuaremos juntos. Ellos son muy fuertes y continuaremos a servir la ciudad de Los Ángeles. With that, I'm going to turn to Spanish for my general remarks. I want to thank all the members of the press, as always. I look forward very much to when we're back in 3 dimensions while we keep our physical distancing. And again, to everybody out there, good work in this past week. It can get even better, though, and continue to do what we can to make July a defining month, just as we did in earlier months, to make sure that this recovery journey continues together, and most importantly, that we save lives of the loved ones that I asked you to picture tonight. Muy buenas tardes, Los Ángeles, y gracias por venir. Hoy nuestro país superó 3 millones de infecciones de COVID-19. En 99 días, nuestro país llegó a 1 millón. En 43 días, llegamos a 2 millones. Y en solamente 20 días, a 3 millones de casos de COVID-19. COVID-19 no se ha desaparecido, se ha vuelto peor. Estoy agradecido a todos quienes están tomando este riesgo en serio, con evitar espacios cerrados y con mucha gente, y quienes están lavando sus manos, llevando una cobertura facial. Pero la verdad es que no hay suficiente gente tomando estas precauciones, y esto es muy preocupante. Este fin de semana había demasiadas reuniones entre familia y amigos, Y necesito que los padres nos ayuden con esto. No permiten que sus hijos vayan a fiestas, ni que se junten con sus amigos. Los jóvenes no están cubriendo sus caras, ni están en muchos casos. Gracias a los jóvenes que están participando y tomando las acciones correctas. Pero estas personas son vulnerables y a esta enfermedad y están transmitiendo la enfermedad a sus padres, abuelos y amigos. Nosotros podemos tomar una vida, pero eso no es complicado. No se reúna con otras personas. Si no vive con alguien, no se reúna con ellos. Es así de fácil. Estoy en comunicación frecuente del condado y con la oficina del gobernador Newsom. Estamos considerando todas las opciones y haremos lo necesario para frenar el brote de este virus, porque mejorar nuestra salud pública es la única manera de reabrir nuestra economía. La semana pasada, los bares y cerró comedores dentro de los restaurantes. Pero asegurar que no tenemos que cerrar más se necesita el esfuerzo y compromiso de todos, tanto los negocios como los individuos. Es muy importante cumplir con estos protocolos en negocios para proteger a sus empleadas y al público. Visita la página coronavirus.lacity.org/business. Y el rato de compliance en inglés, es mejor cada día. Gracias a los negocios que están mejorando su nivel de participación. En el pasado fue menos de mitad. En este fin de semana los inspectores del condado de Los Ángeles recibió un rato de 90 a 98% de acciones buenos. Además, las oficinas solo deben abrir si no es posible el teletrabajo. El nivel de riesgo de infección de hoy es anaranjado. Esto indica que el riesgo es alto y debes asumir que todos alrededor de ti están infectados. Quédate que puedas y solo debes participar en actividades esenciales como trabajo o como un viaje al mercado. Si se vuelve peor, estaremos en el nivel rojo, con el riesgo de infección más alto. Y seguramente regresaremos a un orden para quedarse en casa. Si las cosas se mejoran, estaremos en amarillo, indicando que estamos avanzando en aplanar la curva. Visita coronavirus.lacity.org/threat level para monitorear nuestro nivel de riesgo de infección cada día. Es importante saber los datos que informan. El condado nos informó de 2.496 nuevos casos. En total tenemos 123.004 casos. Entre ellos, 801 están en la ciudad de Los Ángeles, llegando a un total de 52.088 en la ciudad de Los Ángeles. Las hospitalizaciones hemos llegado a 2.004, el más alto nivel que hemos visto en nuestros hospitales. Nuestra tasa de infección sigue más alta que 1.01, pero ha bajado del 1.26 la semana pasada. Esta es una buena noticia, la cual indica que estamos frenando el brote con nuestras acciones. Pero continuaremos. Ayer, en los sitios de prueba de la ciudad y del condado, le hicimos la prueba a 20,000 personas en un día, lo más que hemos hecho en un día. Para mañana le habremos hecho la prueba a más de 1,000,000 de personas en total, en los sitios del condado y la ciudad de Los Ángeles. Claramente no es suficiente. Lo oímos cada día. Y tenemos la esperanza que los líderes federales nos ayuden para brindar las pruebas que necesitamos. Pueden pedir una prueba en la oficina de su médico, este es muy importante, o su clínica en su vecindario, o en las farmacias CVS, en los centros de salud comunitarios. Para encontrar más de 100 sitios de prueba, visita coronavirus.lacity.org/testing o llámanos al 311 si no tienes acceso al Internet. Si piensas que has sido expuesto al COVID-19, por favor hágase la prueba. Pero las pruebas no son por una fiesta o por una razón para estar con sus amigos. Estas pruebas son muy importantes a la gente con síntomas y también la gente sin síntomas en riesgo, pero no hay una excusa por sus acciones peligrosas. Hoy el Departamento de Salud Pública del Condado dio nuevas pautas para quién se debe hacer una prueba. Estas se deben priorizar para personas con síntomas, quienes han sido expuestos o quienes son trabajadores esenciales en ambientes de alto riesgo. Mientras todos se pueden hacer la prueba, no debes usar estas pruebas como excusa responsable. Las pruebas no son para poder reunirse con otros, ahora no deben reunirse con amigos. Mientras más personas se enferman, el suministro de pruebas se puede limitar. Les pedimos que sean responsables con las pruebas, por favor. Además, sabemos que el impacto económico es devastador para muchos durante esta crisis. El lunes 13 de julio, a las 8 de la mañana, se abren las aplicaciones para el Fondo de Alivio de Emergencia para Inquilinos y cierra a las 11:59 de la noche el viernes 17 de julio, la próxima semana. Este programa ofrece $2,000 para hogares sufriendo. Todos los inquilinos pueden aplicar, no importa su estatus migratorio. Es el fondo más grande en los Estados Unidos de una ciudad y es para ustedes, para ayudar a sus familias, para ayudar a sus comunidades, y yo espero que muchos miembros de nuestra comunidad aplicarán por este programa. Para aprender más y someter su aplicación en la próxima semana, visita la página hcidla.lacity.org. Las aplicaciones empiezan en lunes, pero la información existe en este sitio ahora. O llame al 844-944-1868. Estamos haciendo todo lo posible. Además, estamos anunciando que hemos logrado un hotel adicional en el centro de Los Ángeles con 294 nuevas habitaciones para nuestro proyecto Project Room Key, nuestro programa estatal y local que alquila habitaciones para personas sin hogar. Ahora tenemos casi 3,900 habitaciones por todo el condado. Nadie quiere tomar pasos atrás en nuestro camino para abrir de nuevo, ni queremos ver la pérdida de sustentos. Todos queremos controlar el COVID-19 y todos nosotros tenemos un papel en este trabajo. Nuestras decisiones hoy determinan si logramos esto en el futuro. Por favor, lleve una cobertura facial. No se reúna con nadie. Quédense protegidos, quédense en buena salud y cuando puedan, quédense en casa. Gracias, hermanos y hermanas, y fuerza, amor y justicia, Los Ángeles. Muy buenas noches. Thanks, everybody.
also, it's only decent to let them stay here.